Hello viewers, you're most welcome once again to our health talk, and today we want to continue with our series on drug interactions. I'm called Dr. Nuwagira, a pharmacist with Purpose Pharmacy in Mbarara and a lecturer at Mbarara University of Science and Technology. I'm always passionate about talking on drug safety, or how we can make our patients safe with the drugs that we give them, we prescribe and dispense to them. So last time we talked about drug interactions, and we had many people asking that we do something like this again, with more clarifications and extra information on which drugs interact with other drugs. So this is an extra talk to help our patients understand deeper drug interactions, because they are affecting drug safety. They are affecting drug adherence of patients, keeping patients on their medications. If drugs interact and they get problems with our patients, then the patients are likely to stop medication, and that may make the treatment go bad. Okay, so today we want to continue, and I hope we'll do a few more clarifications. Last time, to summarize for you, we talked about what drug interactions are. We also talked about the mechanisms, or how do drug interactions come up. Okay, it is either during the absorption of the drug, the metabolism, the absorption, the distribution, the metabolism or excretion of the drugs. Also, it can also be on how drugs bind the receptors in our bodies. So if you have two drugs antagonizing each other's effects, then, or increasing the effect of one of the drugs or both of the drugs, then you have interactions. So that was covered last time. We also covered factors that predispose us or our patients to drug interactions. And we said that it could be the number of prescribed drugs. If the more the number of drugs that a patient is taking, the higher the likelihood that those drugs will interact, and the effect may be different from what the prescriber intended. We also said that other factors, of course, include treatment duration. The longer you're on drugs, the higher the chances that they are going to interact with your routines. It could be food, it could be other conditions that you are having. So the longer the duration of treatment, the higher the likelihood that these drugs may interact. Patient's age, we talked about how drug interactions can be more among children and the elderly, and which particular interactions do we see in young children, and which one we see in the older adults. So you can always revisit our talk that we had. It is good enough. A youth TV has provided that platform. You can go on our youth TV channel on YouTube, and you will always find it. The other factors, of course, we looked at disease stages. We said the more critical the disease is, the higher the likelihood of drug interactions. And also the physicians that are prescribing. When you go to different medical centers, different hospitals, you're likely to have prescribers prescribe drugs, not knowing that you have been prescribed other drugs by another prescriber. So that is what we covered. Today we want to be more specific on drug interactions. And just to remind you, there are three major modes of interaction. A drug can interact with another drug. A drug can interact with the food, okay, the food that you take, and we're going to see some of them. Or a drug can interact with a disease condition, okay? It may make the disease condition worse or harder to manage. So those are the three major modes of drug interactions. So today we want to do more on which drug interacts with which drug. And I mean, you can cross-check with the treatments that you're on. You can cross-check with your pharmacists, okay? Your pharmacy providers and prescribers to check the different drug interactions. I'll be explaining, the drugs and their conditions and which drugs interact to you. To start with, we always want to give a lot of emphasis on chronic illnesses, okay? And the more prevalent ones is hypertension. So we need to give a lot of attention and caution on drugs used for hypertension, because this is usually a lifelong treatment. And so the drugs that someone is prescribed need to be used cautiously, so that you know which drugs may interact with your antihypertensive medications. One drug is propranolol. Propranolol, that many also call Indero. It also comes in different brands. It's one of the cheaper drugs, and it features in most first-line treatment for hypertension. And that drug can be dangerous in asthma. So if you have hypertension but you also have asthmatic episodes, especially during the cold seasons where the chances of getting asthmatic attacks increase, then we know that propranolol makes the muscles that help in breathing to tighten. It is its mechanism of action. That is how it works to reduce hypertension. But you remember that when we tighten the muscles for respiration, for breathing, then it can result in an asthmatic attack. So usually, if you must use both propranolol and asthmatic or asthma treatments, then you may more likely look for an alternative to propranolol. But if you must use it, then you must increase the dosage of your asthma treatment. Okay, but usually the conventional way we deal with that interaction is that we make sure that it shouldn't happen. You shouldn't take propranolol when you're having asthma. You can use other antihypertensives, okay, that use another mechanism of action, that act differently to reduce your hypertension than propranolol. So that is very clear, and I mean, these are drugs that we use commonly. Someone who has asthma and also is hypertensive, there is a likelihood that he will use propranolol. So if you're asthmatic, Propranolol is not one of those drugs that you should use. We also have a condition called glaucoma, or this is pressure, high blood pressure in the eyes. Okay, it is an eye condition. So you have blood vessels in the eye. Okay, the blood in the blood vessels, in those capillaries, is very high. So we call it glaucoma, high blood pressure in the blood vessels of the eye. So when you have glaucoma, whether you're young or old, and you have allergies, okay, these usual allergies that we usually give diphenhydramine. Diphenhydramine is one of the drugs that we find in many cough suppressants, especially for the dry coughs. So it's a good antihistamine. But when you have glaucoma, when you have that condition in the eye, then this should be avoided, because it is likely going to worsen this condition. It is going to raise the blood pressure in the eye, so it will worsen glaucoma and make the treatment harder. So you must avoid it. It means that if you have allergy and you have glaucoma, you must use another anti-allergy treatment. Okay, so if you go to the pharmacy and you're on treatment for glaucoma, before you take those cough syrups, before you take these anti-allergy antihistamines, make sure that diphenhydramine is not one of them. Okay. Also, in hypertension, there are many nasal decongestants that we don't prefer to use when someone has hypertension, and one of them is pseudoephedrine. Pseudoephedrine is a good nasal decongestant and works by, of course, tightening the blood vessels in the nose, in the sinuses, to decongest the nasal cavities. But when you have hypertension, it will affect the blood vessels throughout your body, okay? And this can cause blood pressure to go up. So if you have hypertension, generally it is recommended to use allergy medications that don't contain a decongestant, okay? If you have hypertension, it's always good not to use nasal decongestants for your allergy medication. There are other allergy treatments that we give. So as long as they don't contain nasal decongestants, then you're safe with your hypertension. And it's something that you need to look out for, because those two conditions occur concurrently more often, okay? Hypertension and allergic reactions, okay, that give nasal congestion. The next, still on pseudoephedrine. Pseudoephedrine will also interact with bromocriptine. Bromocriptine is a drug that we use for Parkinson's syndrome. Parkinson's syndrome is it usually affects the elderly. So the shaking syndrome, when they are holding their drink, they are usually shaking. Okay, either it could have been trauma, maybe they had an accident and the brain got affected and caused Parkinson's, or it could actually be chronic illnesses that end up affecting the brain, and so you get Parkinson's. So we give bromocriptine. Bromocriptine is also used to help mothers who want to wean their babies off breast milk. So when you want to wean your baby off breast milk, you usually give some bromocriptine to prevent the engorgement of the breasts, and inside that you don't feel that pain when you're weaning off your child. Of course, we must make sure that the prolactin that helps you to, easily have breast milk and give to your baby, it must reduce such that you don't get problems. So bromocriptine is used both for Parkinson's and for helping mothers wean their babies off breast milk. But if this is combined with pseudoephedrine, nasal decongestant, then it's going to bring a lot of side effects, okay, which include vasoconstriction. So it will bring some tachycardia. You have heartbeat. Your heartbeat is increasing. Those side effects. So if you're on bromocriptine, make sure that pseudoephedrine is not one of those treatments that you use for your allergies, for your congestion, and all the other conditions. Okay, so those are some of them. Then still in hypertension, there's a drug that we usually use for hypertension, especially reduce edema or swelling in the feet, swelling in the legs, especially in the peripheral. Lasix, you've heard of furosemide. A number of people that are dealing with hypertension are using Lasix. But we know that one of the complications of hypertension is kidney disease. It's one of those complications during hypertension. If hypertension is not well managed, it can, progress into kidney disease. And should that happen, whereas Lasix is a diuretic, it's a good water pill, it removes water. It helps your kidneys to remove extra fluid from your body. But for people with severe chronic kidney disease, then this Lasix may not work as well as it should. So in this case, you may need a higher dose of Lasix to effectively remove the extra fluid from your body because you have, a severe kidney disease. So if it's not increased, if the Lasix dose is not increased, then you're going to have a high problem with your kidneys, and they may fail, okay? As an interaction, of course, because if you were being managed by any other medication, not Lasix, for your hypertension, and maybe you develop kidney disease, then you may be a little safer because we know that there are other drugs for hypertension that help, in this situation. But if your prescriber, if your physician, if your hypertension specialist does not realize that you're on Lasix, for which either he changes the medication or he increases the dose, then your kidneys may fail in the long run. Okay? So, like I said, chronic illnesses are a major, of course, matter of caution when you're dealing with drug interactions. Okay, so the other one is in liver disease. If you have a liver disease, it could be hepatitis, it could be any condition that affects the liver, then it is not advisable that you take paracetamol, acetaminophen, or Panadol that we know for a long time. Okay, Panadol is broken down by the liver. That is how it is removed from the system. It has to be broken down by the liver into usable derivatives in our body. If your liver is not working properly, then if you have liver disease, it means your liver is not working properly. So it means that Panadol cannot be easily broken down. So it becomes toxic. The toxicity levels, okay, for Panadol will increase. And if you have liver disease, you may need to use a lower dose, of course, of Panadol if you cannot use a completely different painkiller, okay? I mean, you could be having liver disease and, malaria, for which you have been given, Panadol, or any other conditions for which we use Panadol. So if you have liver disease, it's important that we use a lower dose of acetaminophen because our liver is not working properly, and so it cannot break down the Panadol, making it, having toxicities. And that is one drug interaction that is very common, by the way, very, very common, because many people, we take Panadol to be, a simple drug that we use all the time. So we use it regardless of the other conditions that we are suffering from. There is still in heart failure, we use digoxin. Digoxin, very small tablets. They are very small. They are usually in 0.5 milligrams, 0.25 milligrams, even 0.125 milligrams. Very small. So we say that digoxin has a narrow therapeutic index. Narrow to me, a narrow therapeutic. In other words, if you're giving the dosage of digoxin, by just increasing 1 milligram, as slight as 1 milligram, it can affect the whole treatment. Okay, so it's a drug that we give in low doses, and we must monitor it in treatment for heart failure. Okay, now digoxin, when given with other drugs that treat, for example, cardiac arrhythmias, those are some pains when you go and they do an ECG and they say that your pacemaker, okay, in the heart is not working very well. You're likely to get arrhythmias, and the treatments for arrhythmias, one of them is amiodarone. Okay, amiodarone, when you give it with digoxin, okay, then you're most likely going to cause a much bigger problem. Okay, the side effects for digoxin increase. Okay, so you have a lot of digoxin in the bloodstream. Okay, which leads to what we call a rebound heart failure, okay, of sorts, because your heart then starts to beat too much, and it may be a little uncontrollable. So when you're taking other drugs, especially in heart failure, the way we combine drugs is very, very key. We are usually careful on which drugs, especially that we combine with digoxin, if digoxin is one of the treatments, because like I told you, it is a drug that takes a very short dosage, and just changing the dosage anyhow can affect the patient. So digoxin is one of those drugs that if you're taking digoxin, you must be careful in which other drugs that you're taking. So you must reach your prescriber, you must reach your pharmacist, and make sure that the monitoring is very well done. The other drug, of course, is levothyroxine. Levothyroxine is a drug we use for treatment of thyroid, high thyroid production. Okay, so when you take it with omeprazole, omeprazole is an usual drug that we use for ulcers. Okay, it's a peptic ulcer. It's a protein pump inhibitor, meaning it reduces, the cause of the acid accumulation during ulcer attack. So, but when you give them together, when you give omeprazole with the levothyroxine, then omeprazole will lower the acid production in your stomach, but then it ends up also lowering the absorption of levothyroxine, making it less effective. So, meaning that if you're treating any thyroid disorder, that needs thyroxine, you either must increase thyroxine dosage when you're taking it together with omeprazole. But increasing thyroxine also, you must do it very carefully, or there are going to be problems. So the best, of course, is to avoid this interaction. But if you can't avoid it, then you must monitor the dosage for levothyroxine. We still on also in back to hypertension. When you have hypertension, sometimes you're very fat and you have high cholesterol levels, for which we give atorvastatin, or what we call statins. Now, atorvastatin is a good cholesterol medication, okay? And it's broken down and removed from your body by, of course, by some enzymes. We usually call them cytochrome enzymes, okay? They are different enzymes. So that's how it is removed in the body. But when you take atorvastatin with normal grapefruit juice, okay? This juice from grapes, for many people that are taking these, grape wines, grapefruit and grapefruit juice can block these enzymes, okay, that are supposed to remove atorvastatin after it has worked in the body. It is supposed to be removed. But with grapefruit juice, these enzymes are blocked, they are inhibited, okay? So this raises the amount of atorvastatin in your body, okay? And that raises the risk effects, okay, of atorvastatin. And most of these statins that reduce cholesterol, when they are not taken out in your body, in other words, if you either take a high dose of atorvastatin, or you have an interaction like a grapefruit juice that increases, the atorvastatin in the bloodstream, then you're going to get side effects of atorvastatin, which include muscle fatigue. You have people that actually start to have muscle aches, pains, okay, that are sharp and sometimes very weak. The muscles get very, very weak. Some people also get bloating, a lot of gas in the stomach, dizziness, okay? So if you take grapefruit juice with atorvastatin, there is going to be a problem. So the best thing is, during the treatment for atorvastatin, don't take grapefruit juice. Atorvastatin can also interact with other drugs that we know. Like I told you, atorvastatin is broken down by certain enzymes, and I mean, when it's broken down, it is well utilized in the body, and so its action is felt. But we know that there are drugs that will block the enzymes that break down atorvastatin. So some of these drugs include erythromycin. Okay, erythromycin is a usual drug that we take for it's bacterial infections of the respiratory tract, or even in urinary tract infections. Bacterial urinary tract infections. So those, when you give them, or even itraconazole. Itraconazole is a powerful antifungal, but if you give them with the atorvastatin, then there are going to be serious complications like kidney failure. Okay, this means that the kidneys cannot remove, the waste. They cannot filter for us the waste products. So that makes the kidneys fail with time. Another statin also, simvastatin. Some people, to reduce their cholesterol, they are on atorvastatin. Others are on simvastatin. Okay, simvastatin does them. It's the same kind of mechanism with atorvastatin. So if you take it with fluconazole is a very good also antifungal. Okay, very, very good. But fluconazole will stop the enzymes that break down simvastatin, and so you have blood levels of cholesterol medication of the simvastatin going up. This causes the side effects that we talked about, similar to atorvastatin. So simvastatin shouldn't be taken with fluconazole. Erythromycin should not be taken with atorvastatin. Okay. Now we go to a drug called warfarin. Warfarin is a drug that we use against blood clots. Okay. Now, when you get a blood clot, usually blood clots are emergency. They're emergency conditions, so they prescribe for you warfarin. Warfarin is one of the cheaper anticoagulants. It's more available in the market, and it's tolerable by a number of patients, but it is one of the drugs that can interact with so many things, be it drugs, be it foods. And warfarin will, for example, when you have warfarin, then it's not good that you take leafy greens, okay? Many of these, green vegetables, because warfarin works by blocking vitamin K, okay? Because vitamin K is, it helps with normal, clotting of our blood, because our blood needs vitamin K to be able to clot normally. Okay, when you bleed, it should clot so that the bleeding can stop. But during a clot, we give warfarin, and so warfarin prevents vitamin K from working properly. So usually the green vegetables are full of vitamin K and can undo some of the warfarin effects. Warfarin is supposed to keep vitamin K in very low, so that the blood clot can dissolve. Okay, but the leafy greens have a lot of vitamin K. Okay, so when you take a lot of vitamin K during treatment for blood clot, then you're reducing the effect of warfarin, which is supposed to help you dissolve the blood clot. So it's necessary to find a balance between the two, and you need to be consistent with how many leafy greens that you eat while taking warfarin. So it's always important that when we have warfarin, we know what kind of food that we must take to help us with treatment for a blood clot. Okay, warfarin can also interact with other antibiotics. Actually, a number of antibiotics are best. It's good to not use them when you have warfarin, including antibiotics like ciprofloxacin, like clarithromycin, metronidazole, Septrin, okay, trimethoprim, and sulfamethoxazole. It's not good to use these with warfarin, because they will increase the effect of warfarin. They will make the blood thinning so much, so it will increase bleeding. It will increase the INR that is a measure, okay, of blood thinning. So here we ask that we use low dose of the antibiotics. Okay, note of warfarin when you're treating blood clot, warfarin is very, very important. And like I told you, blood clots are an emergency, so we cannot reduce warfarin unless if we get another alternative, which are available also. But they are usually more expensive, of course, and they will take more caution. Okay, so here you may have to use a lower dose of the antibiotic so that the interaction is reduced. Okay, avoid concomitant use, of course, if possible, okay, using them together. Or I know that warfarin also interacts with, aspirin, for example, okay, aspirin and many other NSAIDs, or what we call non-steroidal anti-inflammatory drugs. There are many anti-inflammatory drugs that are in the market: diclofenac, aceclofenac, then you have the aspirin. So they always interact with warfarin because they will increase the warfarin levels in blood, which we don't want, because we give warfarin in a dosage to maintain the blood clots to dissolve slowly as we're monitoring it. So but co-administration with some of these anti-inflammatory drugs make it very hard. So usually there's an anti-inflammatory drug, celecoxib, okay, that does not interact with warfarin. It does not have an effect on on vitamin K. So it is safer to use celecoxib, okay, instead of using the diclofenac, the aspirins, okay, because you may be an aspirin in the treatment of hypertension. So in this case, we will ask that they change the medication, because warfarin is one of those drugs that is very hard to deal with. So you must be careful. We have minocycline. Minocycline is a drug that we usually use in itching pimples, but that drug, when we are giving it, it will interact with dairy products. It will interact with milk, with yogurt, with most of these dairy products, because the dairy products lower the amount of the drug that is absorbed by the body. Okay, so if it lowers the amount of drug, it means that the drug won't be as effective. So it's recommended to either take minocycline 1 hour before or 2 hours after taking your dairy products. Okay, take your yogurt separate the administration of minocycline and dairy products. And this also is what we encourage even people that are on tetracycline, people that are on doxycycline. It's always good to take 1 or 2 hours interval from taking dairy products. Okay, going to diabetes. One of the most common drugs that we use for diabetes is metformin. Okay, it comes in different brands. We have glyphomin, we have metformin deng. Metformin is also in diapride, diapride plus, many other combinations that we use to treat diabetes. But metformin interacts with alcohol. So if you're an alcoholic or someone who takes alcohol a long time, and you are diabetic, then you're likely to your diabetes medication, metformin and alcohol can raise the amount of lactic acid. Okay, and then you get what we call lactic acidosis, and it's a life-threatening condition. Okay, so if you take alcohol in a lot of it, and you're on metformin, and especially high dose metformin, then there is going to be an interaction. Okay, so it's good to avoid alcohol with metformin when possible. If possible, it is okay. If it becomes very highly impossible, then you must reduce your alcohol intake. Okay, to 1 or 2 drinks once in a while. Okay, Then we have drugs that are used in a number of psychiatry conditions. Psychiatric conditions. You're talking about depression. You're talking about mania. You're talking about different mental states. So usually there are drugs that we know easily interact. Okay. One of the drugs that we use for in managing depression, in managing anxiety, is fluoxetine. Okay, fluoxetine, and it is given to many patients in the psychiatry ward to reduce anxiety. But this drug, if given with phenerizine is a drug that we use for depression, and anxiety and depression are very close to each other. So when you have that condition, you're most likely you find that you have phenerizine with fluoxetine, which really interact, because when both of them are given together, the symptoms within 1 or 2 doses of fluoxetine within a day, you're able to get a hypertensive crisis. Okay, what we call serotonin syndrome. Okay, where you have a lot of tachycardia, a lot of heart beating, and the blood pressure increasing so fast. So, and that affects your mental state. It brings mental status changes. Okay, you get like confused. It can also get you agitated. Okay, it can also make people to sweat abnormally. You're sweating because the hypertension the blood pressure has been raised so fast. Okay, and I mean it can get into an emergency and you die. So phenerizine, fluoxetine, it's best that the two are not given together. Okay, and I mean the likelihood for them to be given together is high, because anxiety and depression usually occur in the same patients. Then amitriptyline. Amitriptyline is a drug that we usually also use for depression, okay, and mania. But when given with fluoxetine, okay, it increases the level of amitriptyline, the effect of amitriptyline, which is dizziness, drowsiness, sleeping. Okay, you sleep and you become very weak. That's why here we monitor, okay, and consider to lower the dosage of the amitriptyline. Okay, so in our psychiatric patients, it's important that we know fluoxetine has a lot of fluoxetine and all other serotonin selective serotonin reuptake inhibitors, the likes of fluoxetine, paroxetine, escitalopram, sertraline. All those drugs will easily interact with other drugs that we give for depression. Fluoxetine also interacts with tramadol. Tramadol is a very good painkiller, but there is increased potential for seizures. Okay, seizures when you give tramadol with fluoxetine, then some patients have gone into seizures. They become like they are, they have epilepsy attacks. Okay, so you must monitor the patient for signs and symptoms of serotonin syndrome. Okay, yes, it's very important. The interaction makes serotonin in our body. Serotonin is supposed to help us, of course, with what we call fight and flight. It's supposed to make you excited when you must be excited. It's supposed to make you moody when you must be moody. But when there is a lot of it, then it's going to bring a hypertensive crisis. Okay. Yeah, fluoxetine also should not be given with St. John's wort. St. John's wort is a herb, is a very good herbal supplement that is used to treat depression. It is also used to delay menopause. Okay, it's one of those drugs that helps many other conditions. Actually, it's a good herbal supplement. But when you have anxiety and you're on fluoxetine, it's important that you actually don't take that supplement. Okay, you must avoid. Otherwise, you get what we have been explaining. Serotonin syndrome. Digoxin should not be taken with quinidine. We talked about digoxin with other heart failure medications, and one of them now, again, another one is quinidine. Quinidine is used to treat heart arrhythmias that I told you about, when the heart pacemaker is faulty, and so you get arrhythmias which may make your heart not function very well. So if you take it with digoxin, it will lead to high concentrations of digoxin, and like I told you, then you're going to have a lot of cardiac failure. Okay, so that is going to be a big problem. Now let's go to Viagra, sildenafil. Sildenafil is one of the drugs that is highly used at the pharmacies. Okay, there's a recent study that was done, here in Uganda, and sildenafil was among the top 10 medications that are dispensed at community pharmacies. Okay, we know that sildenafil is good to help with manpower. Okay, or it enhances the libido in men. Okay, and helps them with their maintaining their sexual power for a long time. But sildenafil can actually interact with hypertension treatment, especially the one that includes nitrates. Okay, there is a drug called isosabide mononitrate, isosabide dinitrate, the nitrates. Those drugs increase, they work more or less the same way, okay, as sildenafil. Viagra increases the hypotensive effects of the nitrate. So when we give you isosabide to help with angina, anginas are those pricks that you find in the heart, the heart muscle, and we give you isosabide. But if you're also taking Viagra for your sexual power, then the hypertension reduces so much that it goes into what we call hypotension, very low blood pressure. Okay, and that is a crisis, because you have dramatic falls, dramatic drops in blood pressure, and that can be a very, very big problem. So patients taking isosabide mononitrate or any nitrates that I just mentioned, okay, including nitroglycerin, including isosabide dinitrate, should be advised not to take sildenafil. Okay, don't take Viagra when you're on nitrate treatment for angina. Viagra should also not be taken with erythromycin, with itraconazole, with cimetidine. Cimetidine is, we use it for peptic ulcers. Erythromycin, we use it for urinary tract infections and respiratory tract infections. Itraconazole for fungal infections. Okay, ketoconazole for fungal infections. But when you take them with Viagra, they increase sildenafil levels, and sildenafil levels means that you can get this man to to want sex beyond what he can manage, okay, or what his body can manage. and that can be dangerous, in addition, of course, to reducing blood pressure. Then we also have another drug called spironolactone for a number of you that have hypertension. When there is when we must have, it's a diuretic, so it also reduces edema, swellings in the feet, swellings in the legs. It is very, very good, and it protects the kidneys so well, protects the lungs so well. But the combination of spironolactone with potassium chloride, okay, this combination may result in what we call hyperkalemia, or high levels of potassium, and I mean this may lead to cardiac failure. Okay, high levels of potassium increase arrhythmias and also make it can get into cardiac failure. So patients with renal impairment are usually prone, of course, those that have a kidney disease. So spironolactone is a good drug, okay, but in the kidneys, it will lead to excretion of sodium ions, and of course, it will save potassium ions. So when you have potassium chloride, it is going to increase the levels. It's going to increase the levels of potassium, and I mean potassium is one of those electrolytes that the heart needs in in a good measure, not too high, not too low. Okay, even the kidneys need it. It shouldn't be too high, it shouldn't be too low. So patients receiving these other diuretics that remove the potassium, okay, are very helpful here. Okay, but they must also be given in the right doses. Then we have other interactions, for example, of fluoroquinolone, ciprofloxacin, levofloxacin. These are powerful antibiotics that we use for management of urinary tract infections and many other bacterial infections. But when they are given with sacralifate, sacralifate is a drug that we always love in management of peptic ulcers. Okay, it helps with healing of the ulcer. But when it is given with these antibiotics, then there is a decreased absorption of the antibiotic. So the antibiotic is not absorbed very well, and so that makes it toxic in the body. So it is it's one of those things that you must look out for. Carbamazepine integral in management of seizures. When you give it with cimetidine, which is used for ulcers, when you give it with erythromycin, clarithromycin, which are very good antibiotics, or even fluconazole, it will increase carbamazepine levels. So it means that there is going to be a lot of carbamazepine in the body, and carbamazepine side effects will then come into play. Okay, rifampicin with carbamazepine, it will decrease carbamazepine. Okay, so the antibiotics will increase carbamazepine levels, but rifampicin that we usually use for tuberculosis, okay, when you give it with carbamazepine, then carbamazepine levels in blood reduce, so you're not able to manage seizures in this epileptic patient. Okay, phenytoin that we also use in epilepsy, okay, should not be given with those same antibiotics that we talked about, okay, because then phenytoin levels will increase and they become more toxic. Phenobarbital with rifampicin shouldn't give. Why? Because it will decrease. So rifampicin, the drug that we use for tuberculosis, it reduces phenytoin levels in blood. It reduces phenobarbital levels in blood. It reduces carbamazepine levels in blood. So when you're an epileptic patient who is supposed to prevent seizures, okay, then and you develop tuberculosis, okay, please, you have to be careful on using rifampicin, or they will change your anti-seizure treatment so that they will maintain you on rifampicin, but with anti-seizure treatment that does not include phenytoin, does not include phenobarbital, or does not include carbamazepine. Okay. Drug interactions. Lastly, we want to look at oral contraceptives. Oral contraceptives should not be taken with rifampicin, okay, because rifampicin will decrease the levels of oral contraceptives. So when you want to prevent pregnancy, but you have TB, so you're using oral contraceptives, rifampicin, if you take it with the oral contraceptive, you're likely to get pregnant because it will decrease the effectiveness of the contraception, okay, or that contraceptive that you're taking. It reduces it, and when it reduces it, then you get pregnant, and you ask. There are many people that have gotten pregnant on contraceptives, and some of the reasons are the drug that they interact with. So avoid, if possible, if the combination is necessary, have the patient take an oral contraceptive pill with a higher estrogen content, okay, a much higher estrogen content, such that if you must keep the patient on rifampicin, okay. Oral contraceptives also interact with many antibiotics, okay, so it's always good to know, to tell your pharmacist which antibiotic you're on when you're on contraception. And there's also many anti-diabetic drugs that if you take them with oral contraceptives, then you're going to have high levels of, lower levels of oral contraceptives, okay. Think drugs like troglitazone, pioglitazone, rosiglitazone for diabetes, okay. If you take them with the oral contraceptions, okay, if you take them with your the contraceptive pills, then they will reduce contraceptive levels, and then you may be pregnant. So it is important to know that they are able to change medication, your diabetic medication, that does not include the glitazones, okay. So there are many other, we may not of course exhaust all the interactions, but as most of you requested, of course, for particular interactions, I hope that you have been able to pick one or two that you use, or your mother uses, or you know a friend that has a condition, and so you may pick one or two drugs that may be interacting, and so you reach out to your pharmacist, you reach out to your prescriber, and also for knowledge, for you to know how to deal with drugs, because it is a very key area for drug safety. And like I told you, we do drug management. We use drugs to manage medical conditions, and if we don't take the drugs the right way, and if we do not maximize their use, then we have treatment failures, and there have been so many people their condition fail to get treated, and they ask why, not knowing that you have not been taking drugs the way they have been prescribed for you, or you have not let the prescriber on what all the drugs that you're taking, or all the foods that you're taking, those supplements, those drinks, those energy drinks that we talked about last time. It's important that you declare all the drugs that you're taking, you declare them to the pharmacist, then he's able to know which ones are likely to interact and how to go about them.